Understanding the human body starts with a foundational language, a way to describe where things are and what they're called. Today, we're diving into that essential vocabulary, from specific body regions to the intricate workings of cells and systems.
That's right. We'll explore everything from the broad substudies of anatomy to the tiny organelles within a cell, and how all these parts are organized to form a functioning human being. It's truly a building block approach.
So let's begin with how we even categorize the study of anatomy. What are the main subfields we need to be aware of?
We start small with cytology, which is the study of cells and their organelles. Then we move up to histology, which examines tissues and their structure. Beyond that, there's gross anatomy, covering structures visible to the naked eye. Regional anatomy focuses on specific body areas, while comparative anatomy looks at structural differences between species. Finally, developmental anatomy tracks changes from fertilization all the way through adulthood.
That creates a comprehensive picture. And how do all these studies fit into the levels of structural organization within the human body?
It's a clear hierarchy. We start at the chemical level, with atoms and molecules like carbon, hydrogen, oxygen, and nitrogen. These molecules then organize into cells, forming the cellular level. Cells themselves fall into molecular categories like carbohydrates, lipids, proteins, and nucleic acids. When cells group together, they form tissues. We have 4 primary types: epithelial tissues for coverings, connective tissues for support, muscle for movement, and nervous tissues for communication. These tissues then form organs, which work together in organ systems, and all the organ systems together make up the complete organism.
It's remarkable how everything builds up from such fundamental components. And the human body has 11 major organ systems. Could you walk us through some key examples of each?
Certainly. The cardiovascular system includes the heart, arteries, and veins. The digestive system involves the stomach, liver, and intestines. For the endocrine system, we think of structures like the hypothalamus and adrenal glands. The lymphatic system has the spleen and appendix. The muscular system encompasses muscles like the biceps femoris. The nervous system includes the cerebrum and spinal cord. The reproductive system features testes and ovaries. The respiratory system has the lungs and bronchi. The skeletal system is simply bones. The urinary system consists of the bladder and ureters. And protecting everything is the integumentary system, which is our skin, hair, and nails.
That's a thorough overview of the major systems. Now, when we talk about specific locations within the body, especially the torso, how do we precisely define regions like the abdomen?
The abdomen is often divided for clinical precision. There are 9 regions: the right hypochondriac, epigastric, and left hypochondriac across the top, the right lumbar, umbilical, and left lumbar in the middle, and the right iliac, hypogastric, and left iliac across the bottom. For quicker reference, clinicians also use 4 quadrants. These lines cross at the umbilicus, or navel. The right upper quadrant holds most of the liver and gallbladder, while the left upper quadrant contains the stomach and spleen. The appendix and cecum are found in the right lower quadrant, and the sigmoid and descending colon are in the left lower quadrant.
That level of detail is critical for diagnosis. Beyond regions, directional terms are another essential aspect of anatomical language. What are some of the most fundamental terms we use?
The core terms describe position and relationship. Superior means toward the upper part of the body, while inferior is toward the lower part. Anterior means toward the front, and posterior is toward the back. Medial means toward the midline, and lateral is away from it. Intermediate describes a position between 2 structures. Proximal means closer to the origin or attachment point, while distal is farther away. Superior is toward the body surface, and deep is away from it, protected by other structures. We also have contralateral, meaning on opposite sides of the body, and ipsilateral, on the same side. Finally, parietal refers to a membrane lining a body wall, and visceral to one covering an organ.
Those terms provide a clear framework, and how do we think about making cuts or slices through the body for anatomical study?
Those are body planes. A sagittal plane divides the body into right and left portions. If it's an equal division, it's mid-sagittal. If unequal, it's parasagittal. A frontal or coronal plane divides the body into anterior and posterior parts. A transverse plane divides it into superior and inferior sections. We can also have oblique cuts, which are angled.
Now, taking a step back to development, what are the primary germ layers that give rise to all these tissues and organs?
There are 3 primary germ layers. The ectoderm is the outer layer, forming structures like the epidermis of the skin and nervous tissue. The mesoderm is the middle layer. This is where muscle, bone, connective tissues, and blood vessels originate.
The endoderm is the inner layer, which forms the inner epithelial linings of organs, specifically for the respiratory and digestive systems.
It's fascinating to see how these initial layers differentiate into such diverse structures. Moving on to specific regional terms, when we describe the head and neck, what are some key terms a student would need to know?
For the head, we have cephalic for the entire head, cranial for the skull, and facial for the face. More specifically, frontal refers to the forehead, orbital to the eye, nasal to the nose, buccal to the cheek, oral to the mouth, and mental to the chin. The neck is simply cervical. This vocabulary lets us pinpoint locations precisely, like saying the brain is in the cranial region.
And for the upper torso, how do we describe areas like the shoulder, chest, and armpit?
The shoulder is the deltoid region, or acromial for the shoulder point. The chest area is thoracic, with the sternal region for the sternum, and pectoral for the area over the pectoralis major muscles, and mammary for the breast. The armpit is axillary. From there, the upper arm is brachial, the front of the elbow is antecubital, and the forearm is antebrachial. The wrist is carpal, the palm is palmar, and the fingers are digital, also called phalangeal.
That gives us a clear map of the upper body. What about the lower body and posterior regions?
For the pelvis and lower body, we have pelvic for the pelvis itself, inguinal for the groin, coxal for the hip, and pubic for the anterior pelvis. The thigh is femoral, the kneecap is patellar, and the lower leg from knee to ankle is crural. The ankle is tarsal, and the foot is pes or pedal. Looking at the posterior or back regions, the back of the head is occipital, the ear is otic, the shoulder blade area is scapular, the spinal column is vertebral, and the lower back is lumbar. The back of the elbow is olecranon, the buttock is gluteal, the back of the knee is popliteal, and the calf is sural. The heel is calcaneal. Knowing these terms allows us to say, for example, that the hip is superolateral to the inguinal region.
The precise definitions are vital. Now, let's turn our attention to the internal body cavities. What are the main divisions, and what structures do they contain?
We broadly divide the body into dorsal and ventral cavities. The dorsal body cavity contains the cranial cavity, which holds the brain, and the vertebral cavity, which houses the spinal cord. The foramen magnum is the anatomical structure that marks the division between these two subdivisions. The ventral body cavity is much larger, containing the thoracic cavity, which includes the heart and lungs, and the abdominopelvic cavity. The diaphragm muscle divides the thoracic and abdominal cavities. The abdominal cavity contains organs like the stomach, spleen, liver, and intestines. Below that, the pelvic cavity holds the bladder, reproductive organs, and rectum. The boundary of the pelvic cavity is defined by the plane from the superior surface of the pubic symphysis to the sacral promontory.
It's clear that these cavities protect vital organs. And within these cavities, what are the different types of membranes and their functions?
We have several. Serous membranes, for example, line body cavities and cover organs. They have a parietal layer, which lines the cavity wall, and a visceral layer, which covers the organs themselves. The pleura covers the lungs, and the pericardium covers the heart, both secreting serous fluid to reduce friction. The peritoneum is the serous membrane covering the abdominal organs and lining the abdominal cavity. Mucous membranes line the digestive tract. The skin is a cutaneous membrane, made of stratified squamous epithelium with an underlying layer of areolar connective tissue. Each freely movable joint is lined with a synovial membrane.
That's a thorough breakdown of how the body's surfaces and internal structures are protected. Now, let's shift our focus to the cellular level, starting with basic cell types and chromosomes.
Cells are broadly classified as sex cells, also called gametes, and somatic cells. Gametes, like sperm and ova, are haploid, meaning they have half the number of chromosomes, symbolized as N. Somatic cells are diploid, having a complete set of chromosomes, or 2N. Mitosis is the process of somatic cell division, used to replace or damaged cells. Meiosis is the division process that creates sex cells.
So, different types of cells divide for different purposes. What about the internal machinery of a cell, the organelles? What are some of the key players and their roles?
Each organelle has a specialized function. The nucleolus creates ribosomal subunits. The nuclear envelope separates the DNA from the cytoplasm. Free ribosomes synthesize proteins within the cytoplasm. The centrosome organizes microtubules for cell division. Mitochondria are the powerhouse, producing ATP for energy synthesis. Lysosomes digest and destroy engulfed material, while peroxisomes use peroxide to detoxify chemicals. The Golgi apparatus packages and modifies cellular products. Rough ER synthesizes membranes membrane proteins, and smoothie R stores calcium, becoming sarcoplasmic reticulum in muscle cells. Flagella propel entire cells, as seen in sperm, while cilia move materials over cell surfaces. Microvilli increase the surface area of the membrane. Cytoplasm is the gel suspending organelles, and cytosol is the fluid within it.
That's an intricate internal world, and the cell membrane itself is a complex structure. What are its essential components and their functions?
The phospholipid bilayer forms the fundamental barrier between the inside and outside of the cell. Glycoproteins are used by the immune system to identify cell type and aid adhesion. Glycolipids provide chemical markers and stability. Protein channels allow selective transport across the membrane. Integral membrane proteins act as receptors, recognizing and allowing responses to molecular signals. Cytoskeletal filaments provide the cell's shape and structure. Peripheral membrane proteins can act as membrane-bound enzymes, moving around the membrane's face. Cholesterol regulates membrane fluidity.
Each component contributes to the membrane's dynamic function. Now, let's look at early embryology. How does a single fertilized cell develop into a more complex structure?
It begins with the zygote, the single fertilized cell. This divides to form a solid ball of 16 cells called a morula. The morula then develops into a blastocyst, which is a hollow ball of cells. The blastocyst contains trophoblasts, which form the placenta, a cavity called the blast of Seal, and an inner cell mass that becomes the embryo. The zona pellucida surrounding it prevents multiple sperm from entering the egg. Later, the cells rearrange into two major layers, the epiblast, the top layer, and the hypoblast, the bottom layer.
And these layers then develop into the three primary germ layers we discussed earlier through a process called gastrulation.
Precisely. During gastrulation, a primitive node and primitive streak form in the midline. Cells move inward through this streak to form the new layers. The epiblast gives rise to the ectoderm, which forms nervous tissue and the epithelial tissue of the skin. The mesoderm forms muscle, bone, connective tissues, and blood vessels, and the hypoblast supports embryonic tissues and contributes to the endoderm, which forms the lining of the respiratory and digestive systems.
That's a powerful summary of the incredible journey from a single cell to a complex organism. To reinforce some of these key ideas, let's quickly review some relationships. My right nipple and spleen are on opposite sides of the body, so they are what?
Contralateral.
And my right nipple and liver being on the same side?
Ipsilateral.
The heart is nestled deep within the chest, medial to the lungs, and protected by the ribs. This means the heart is what relative to the ribs?
Deep to the ribs.
What about its position relative to the spine?
The heart is anterior to the spine.
And the membrane covering the surface of the lung is what?
The visceral pleura.
While the membrane covering the thoracic wall is...
The parietal pleura.
Thinking about the cell membrane, which molecule is crucial for modulating its fluidity?
Cholesterol.
And what do glycolipids and glycoproteins act as on the cell surface?
Cell identity markers.
Finally, the shoulder is closer to the trunk than the elbow, making it what relative to the elbow?
Proximal to the elbow.
And the foot, further from the trunk than the knee, is what to the knee?
Distal to the knee.
This comprehensive overview truly highlights the sophisticated organization and precise terminology used in anatomy, from regional names to the functions of organelles and developmental processes.
It's all about building that foundational understanding, seeing how every part contributes to the whole, and having the language to articulate it clearly.
If you found this discussion helpful, share this episode with someone interested in learning about the human body.